Hello, everybody. This is Laura Cole Gonzalez. I just wanted to jump on here regarding the flu and to talk a little bit about the flu. A family member of mine currently hasn't been feeling well, and I wanted to make sure that they had the facts and data and knew what to do and also knew what not to do. So many times we go to the doctor and you have different symptoms and you're not sure what's going on. And many times the doctor hands you an antibiotic, and I say it's like handing folks antibiotics without really knowing what's going on truly, or sometimes the patient pressures the doctor to give them an antibiotic. So I want to just go over a few things that are very near and dear to my heart, and I shared this with a loved one that is very near and dear to my heart. So it's as if I'm talking to this loved one, so that way you know where I'm coming from. So with regarding the flu, it's usually due to an influenza virus, okay? And folks that are not aware, there's virus issues, right? There's viral infections, and then there's bacterial infections when we are getting sick, right? So a lot of times folks don't realize there's a big difference between a virus and a bacterial infection. Okay, so that's something that really folks should start learning sooner than later, especially young moms. I wish that I knew more when I was a young mom instead of just blindly going by what my doctor said, or blindly even for myself when I was going to the doctors for different health challenges. So anyway, so getting through this flu question, right? So the question is, do you have the flu? And now you can actually take a quick test and be sure that you have the influenza virus and not something else. So having that test is very helpful. It's not 100%, but at least it gives the doctor an indicator. Is it viral or is it something else, right? So with the flu virus, you really do not want to be taking an antibiotic because it's viral. And antibiotics only work on bacterial infections, not on viruses. So that's a critical piece of information that I wish we learned in school, right? Like when we take certain classes in school, I wish there was a class on explaining this part of our health piece. You know, if we don't know the difference, we'll ask the doctor for an antibiotic, unbeknowing that the antibiotic won't help. And actually the antibiotic will do harm to the body because there's no bacteria for it to kill off. And in some cases, it can start having symptoms and damage to the body, okay? So that's one. So really helping you would be very helpful to know that, okay? So that's something that can happen. Now, some folks say, well, how does the test work? The doctor actually will rub a swab, like a cotton swab, just like the kind that you have at home, right? And it'll rub along the back of your throat, up your nose, and then it'll put it out for a test. And usually it takes it's pretty quick. Usually comes back within 15 minutes. So it's very great to have as a potential option in the doctor's office. So I'm all about tools. So this is a great diagnostic tool to have. All right, so that's where it also can, then the doctor also can figure out what type of flu that you have, okay? So now here's where I wanna really talk further, because I was texting my loved one a lot today regarding this, because I wanted to make sure that the doctor did not give my loved one a specific type of antibiotic, even after the fact of explaining that if it's viral, you don't need an antibiotic, but just in case, because a lot of times the doctor will write a script or hand the patient the drugs and you don't know any better and you leave. So I wanted to make sure they did not write the script for a family of antibiotics that I personally have been severely damaged from at a very young age in my life. So This particular family I want everybody to know about, so that way you're extra careful when you are taking an antibiotic. You really look at the class of antibiotic it is, as well as the side effects. So this particular antibiotic is in the fluoroquinolone. I can never say it properly, so the pronunciation is fluoroquinolone, okay? And this particular antibiotic family is a broad spectrum antimicrobial antibiotic, okay? But it also has a large risk to it, okay? So I want to go over to two of the most common antibiotics that can be prescribed and what are some of the side effects. Okay, so I'm going to start with this one. Most of you may be familiar with Cipro. Okay, the full name of Cipro is Ciprofloxacin. Most of you don't hear the after part, the floxacin. Okay, you only hear the Cipro part. Anything in the flox family is in this fluoroquinolone family. Okay, so just be aware of that. So when you first look at it, you say, okay, no big deal, Laura, what's the big deal? Well, first of all, Cipro was created for exposure to anthrax and certain types of plagues. So really it was an antibiotic that was specific for something that, like again, when we talk about anthrax, that's kind of pretty intense bacteria, right? So, but what folks don't realize, and thankfully they've been forced to put better labeling on this antibiotic. And in fact, I've been part of an organization that was helping to make sure that the FDA helped with making sure the drug companies put a black label on this antibiotic so folks know that when they take this, what are the risks? And I say to folks all the time, folks are taking antibiotics like Skittles. So they're taking them like they're no big deal and there's, no ramifications. Well, these antibiotics can do major damage to the body, and I'm a walking, talking, living proof of that. And maybe some of you know me, don't realize some of the health challenges I've gone through, but when I get further through here, you're going to understand a little bit more of why I want to make sure every loved one I know knows the facts about this family of antibiotics. Okay, so here's line 2 that I'm very happy that's finally showing up. So this particular antibiotic can cause serious or debilitating side effects. Ciprofloxacin should only be used for infections that cannot be treated with a safer antibiotic. Okay, so they're finally putting that can cause, right, debilitating side effects. So now let's go down here. Important information. This is another thing that they're finally putting on the label. Cipro may cause swelling or tearing of a tendon. And then it says, especially if you're over 60 or if you're on steroid medication or have a heart, kidney, or lung transplant. Well, I'm here to tell you that I was not over 60. I'm not over 60. And this family of antibiotics did cause major issues with my tendons to the point that I was at one point in a wheelchair. So this antibiotic did so much damage to my body. Not only did it do damage into my tendons, to my ligaments, it caused major pain throughout my entire body. It also started to eat away at the lining of my bladder, because in my case, I was given Cipro even though I did not have a bacterial bladder infection. And I was given Cipro more than one occasion by a doctor that really did not do his homework to see that I did not have a bacterial infection and gave me this. So this is something that I unfortunately was exposed to at a pretty young age. I was only in my early 20s when this occurred to me. And it really has done such detrimental, hazardous problems to my overall health. And I could go on and on about all the other symptoms that I've had or the things that I've dealt with. But this is where I want to explain to you why I'm so passionate about sharing this with folks so that you know this is an antibiotic that you do not want to take unless you have to. okay? And when I say have to, we have choices. There's so many solutions out there that you can. There's other things that do no harm to the body, do no harm, okay? So I am very passionate about teaching folks things that they can do that are much safer, that do no harm to the body, that work in synergy with the body instead of working against the body. So let me just go through this a little bit further so that you understand. So the other thing that you need to be very careful is, see here, this steroid medication. And many times I'm seeing moms giving their child Cipro, and they're also on a steroid type of medication at the same time, because many times they have other symptoms, and the doctor will give them a form of steroid with this antibiotic. So be very, very careful, because again, if you're taking it in combination, it can really do major damage. Tendons are one of the many, many side effects that this particular antibiotic can have. So again, please go to, again, this website's common. Anyone can go there. Go to drugs.com and type in your antibiotic and see what are the side effects. What are the potential side effects? A lot of times we don't read those pamphlets, or we deny even taking those pamphlets when we're at the drugstore to get our medicine. So be sure to read exactly what's going on. There's the other tendon problems, arthritis, joint problems, right? Especially in children. And going on, muscular disorders, heart rhythm disorders, okay? This is critical. There was a young man that actually had passed away after taking this antibiotic and left behind his wife and children. So this is serious stuff, folks. And one of my goals this year is no BS. Telling you the facts, no BS. Enough with the BS that we're being told. It's not true. You need to see the facts and data and be careful on what we're ingesting into our bodies. Okay, you can go on and on. Liver, kidneys, right? Seizures, diabetes, low levels of potassium in your blood, right? Blood thinners. So the list goes on. And again, it starts talking further, right? So, again, I also had some Achilles heel tendon issues. So again, other issues that were side effects to this particular medication, okay? So now let me go to the next family just so you see what I'm also talking about. So the other family that, the other antibiotic in this family of class of antibiotics, right, is another one that's very common that many of you have heard of, right? So it's the Levofloxacin, right? Still in that same family, right, of antibiotics. Okay, so now this one, a lot of times folks are given for sinus infections, kidney infections, bladder infection, or prostate infections. It's also been used to treat bacterial infections like bronchitis or pneumonia, and also folks that have been exposed to anthrax. So again, this is another one this time of the year that folks are being prescribed to, but don't really know the side effects, okay? You can also click on the side effects button and also see additionally what are the side effects of any drug. So again, this one, same problem, right? Same issue. But again, I'm here to say I was not over 60, very young. Okay, and still in my years now, still paying the price to the severe damage that it's done to my body. Okay, so here's some of the side effects, right? So you think diarrhea, insomnia. Okay, one of the things with diarrhea is it's killing good and bad bacteria in your intestines, in your flora. So many times folks are not being taught that when you're taking an antibiotic, you also need to be taking a good probiotic, okay? So that is something that can help you not have these issues. But anyone that's ever taking any antibiotic, you should be taking a probiotic, good refrigerated probiotic, for at least 30 days to 6 months to gain back the intestinal flora, the good bacteria that your body loses whenever it takes an antibiotic. So that's very important, very critical to know. And I wish every doctor would inform their patients of this because it's such a critical thing. 70% of your immune system resides in your intestines. I'm going to say it again. 70% of your immune system resides in your intestines. So it's very important to replenish your intestines with that good flora, okay, that good bacteria. So be sure to do that. One suggestion is take it in between your dose of antibiotics. So say it's twice a day, take the antibiotic in the morning and at night, or however it is that it's telling you to do it. And then maybe in the middle of the day, you take your probiotic. Or maybe it's in the morning, you take your antibiotic, at night, take your probiotic, so that all night long, your body has a chance to try to replenish some of the good bacteria that's also killed off. So again, that's another side effect to taking an antibiotic. It's killing good and bad, okay? So again, talking more again about damage for the tendons, tendinitis, tendon ruptures, right? Many times folks will say, well, I didn't have that problem, but then 3 or 4 months later, you start to have all these issues, right? Your muscles start to have issues. You're starting to have tendinitis. You might have other symptoms with the joints and weakness, right? Or overall atrophy of the joints and the muscles, trouble breathing. You know, this is another one. And this one also comes orally and a syrup and as an oil tablet. Both of these also come as eye drops and ear drops. So you may be actually getting these in your body and not realizing that they were in an eye drop or an ear drop, okay? So it's another side effect that also I've experienced personally. So here's other ones where, again, don't look at rare and just blow it off, because you may or may not have this issue, and it's best to educate yourself. So again, read up on them. This one has, you know, a lot of them. Tremors. My legs used to shake off my bed at night, and I didn't know what was going on. I had no idea. Blurry vision is another one. Convulsions. A lot of other issues with your urine, breathing, swallowing, irregular heartbeat, hives, hoarseness, joint muscle pain, peeling or losing skin, puffy eyes, serious dizziness, chest tightness, unsteady or awkward walking. So you can also have vertigo or tinnitus, right? Bleeding or bruising, weakness, vision changes, voice changes, weaknesses. So, you know, those are some. Then here's minor ones that they're saying minor, but still. Constipation, dizziness, headaches, lightheadedness, nausea, trouble sleeping, vaginal itching and discharge. This is another good one to talk to with females. When you take an antibiotic, how many of you can raise your hand and say you end up getting a yeast infection after you're on an antibiotic? So this is a great example of how the good bacteria gets affected when you're on an antibiotic, and why you end up getting an overgrowth of what's called candida. And then you have that problem in your vaginal tract, and then you start to get a vaginal issue. And then what happens? You go back to the doctor and get another drug that now you're taking because of the side effects of the antibiotic. So I hope that this helped you. I know this was a lot of information. I hope that this helps somebody out there that needs to know this, has the new education, is able to go to these websites, pull it up on your phone, look at the side effects of any drug. But these two in particular are part of this family of drugs, the fluoroquinolone, and I can never say it correctly, fluoroquinolone drug, okay? So definitely do your homework, look it up. There's a few more drugs that are in this one, but those are the two main ones that most of you might hear about or get prescribed to when you have the flu. And so many folks are sick right now that I want to make sure that you know the risks, that you know that these are some of the families, and request a different one, okay? Request something else. Now, again, this is another thing folks don't realize. When a doctor goes to school, many of doctors are my dear friends, and I've been working in the health and wellness industry for well over 20 years. So I'm aware of a lot of things that go on. in university. So they have their education has been funded by pharmaceutical funding, and their education is based on learning medicine. Okay, so their tools in their toolbox are going to be medication. So when you go to them and say, well, can I take something else? Is there an alternative to medication? Don't expect them to have a degree or understanding of other types, because if they're a medical doctor, they went to school to learn medication, medicine. Don't go to a surgeon and say, well, what else are my options? Because his tools in his toolbox are going to be surgical tools. So just be aware of that. When you go to a doctor, their specialty is that, okay? When we're talking about functional medicine, right, or integrative medicine, those doctors went to school specifically for that. So they will have integrative solutions. They will think of it a little differently instead of allopathically and thinking, treating a symptom. A integrated functional doctor will say, what is the root cause? Why does this person have XYZ? And try to get to the root cause. And then some of them have been trained with alternative options, functional medicine. Some of them have training with herbal or maybe naturopathic solutions. Then there's naturopathic doctors, there's homeopathic doctors. So again, a homeopath would study homeopathy and give you homeopathic remedies. So again, knowing there's different things out there, herbalist will know more about herbs, right? So again, my studies as a mom, I've always been on a quest for health and wellness for myself, also my children. So I was studying naturopathic solutions as a mom to help my children and my family with naturopathic ways. So over time, I developed more and more tools for my own personal toolbox that I could help my children, myself, and my husband. So, again, I didn't learn this overnight. It definitely was a journey, and many of the journey wasn't easy because of some of the side effects and things that I went through personally. So I just want to make sure that all of you know that there are other solutions. There are other options. There is other ways that do no harm to the body. And I hope that this helps somebody else. Thanks so much and have an amazing day. If you want more information, feel free to reach out to me at livewithlaura.com, or you can also like me on Facebook, which is Live with Laura. I'm also on Twitter. And I hope that this helps somebody else out there to know there's other solutions and things that if you're going to take, to be aware to what to look out for in case your loved one does have any sort of side effects.